Pathophysiology is the study of how the body's normal functions change due to disease or injury. Understanding pathophysiology is crucial for healthcare providers to gain insights into the underlying causes and mechanisms of various health conditions. By studying how the body's systems and processes are disrupted by disease, we can better understand, diagnose, and treat those conditions. This presentation will provide an introduction to the key concepts and principles of pathophysiology, which form the foundation for understanding many medical conditions. Homeostasis is the body's complex system of regulatory mechanisms that work to maintain a stable internal environment. This delicate balance is essential for optimal functioning of organs and cells, things like temperature, fluid balance, pH levels, etc. Disruptions to homeostasis can lead to a wide range of health problems, so understanding how the body maintains this equilibrium is very important. The image on this slide shows detailed anatomical diagrams of the body's regulatory systems that help maintain homeostasis. I'll highlight a few key points about how these systems work to keep the body in balance. Inflammation is the body's natural defensive response to injury or infection, characterized by redness, swelling, and pain. This is a crucial process for healing and preventing further damage. The immune system is a complex network of cells, tissues, and organs that work together to detect and eliminate threats, such as viruses, bacteria, and abnormal cells, protecting the body from disease. The inflammatory cascade involves vasodilation, which increases blood flow to the affected area, immune cells and chemicals being recruited to the site of injury or infection. This inflammatory response helps to eliminate the threat and initiate the healing process. Cardiovascular diseases like hypertension and myocardial infarction can have serious consequences if left unmanaged. Hypertension or high blood pressure can lead to heart disease, stroke, and kidney failure if not controlled. Myocardial infarction, commonly known as a heart attack, occurs when blood flow to the heart is blocked, causing tissue damage. Regular checkups and monitoring are crucial for early detection and management of these conditions. Treatment options range from lifestyle changes to medications and surgical procedures, depending on the specific condition. Respiratory disorders like asthma and COPD can significantly impact breathing and quality of life. Asthma is a chronic inflammatory condition that causes recurrent episodes of wheezing, shortness of breath, and coughing. COPD is a progressive lung disease, often caused by long-term exposure to lung irritants like smoking, leading to airflow obstruction. Both conditions require ongoing management through medications and lifestyle changes to control symptoms and prevent complications. Severe unmanaged cases of asthma or COPD can lead to serious complications like respiratory failure or lung infections. Strokes are a sudden disruption of blood flow to the brain, depriving brain cells of oxygen and nutrients. This can lead to long-term disability or even death if not treated promptly. Alzheimer's disease is a neurodegenerative condition that causes progressive memory loss, thinking difficulties, and changes in behavior. It is the most common form of dementia among the elderly. Modifiable risk factors for both stroke and Alzheimer's include high blood pressure, diabetes, smoking, and physical inactivity. Maintaining a healthy lifestyle can help reduce the risk of developing these neurological disorders. While there is no cure, new treatments and therapies are being developed to manage symptoms, slow disease progression, and improve quality of life for those affected. Diabetes is a chronic condition where the body fails to properly regulate blood sugar levels. This can lead to serious health complications if left untreated. The root cause can be the pancreas producing insufficient insulin or the body becoming resistant to insulin. The thyroid gland plays a crucial role in regulating metabolism. Imbalances in thyroid hormones can result in hyper or hypothyroidism. Symptoms of thyroid disorders include fatigue, weight changes, and mood swings. Proper monitoring and medication can help manage thyroid conditions. It's important to understand both diabetes and thyroid disorders, as they are common endocrine system imbalances. Digestive tract diseases like ulcers and irritable bowel syndrome, IBS, can cause significant discomfort and disruption to daily life. Ulcers are painful sores in the stomach or small intestine, often caused by H. pylori bacteria or certain medications. Symptoms of ulcers include abdominal pain, bloating, and nausea. IBS is a chronic condition characterized by abdominal discomfort, changes in bowel habits, and other gastrointestinal symptoms. Triggers for IBS can include stress, certain foods, and hormonal fluctuations. Managing these conditions often involves dietary adjustments, like identifying and avoiding trigger foods, increasing fiber intake, and staying hydrated. A balanced diet can help alleviate symptoms. Prescription medications, such as antacids or antibiotics, can also help treat the underlying causes. Stress management techniques can provide additional relief for those with digestive tract diseases. Kidney stones are a common and painful condition caused by hard mineral deposits that form in the kidneys. They can be caused by dehydration, certain dietary factors, or underlying medical conditions like diabetes or high blood pressure. Kidney stones can cause severe pain when passing through the urinary tract, so effective pain management is crucial. Chronic kidney disease is a gradual loss of kidney function over time, often due to conditions like diabetes and high blood pressure. If left untreated, chronic kidney disease can lead to complete kidney failure, requiring dialysis or a kidney transplant. Treatments for renal disorders include managing the underlying causes, pain relief for kidney stones, and dialysis or transplant for end-stage kidney disease. It's important to work closely with a healthcare provider to develop an effective treatment plan for any renal disorder. Arthritis is a painful condition that causes inflammation and stiffness in the joints, often due to wear and tear or autoimmune factors. Common types include osteoarthritis and rheumatoid arthritis. Osteoporosis is a degenerative bone disease that leads to weakened bones and increased risk of fractures, typically affecting older adults, especially postmenopausal women. Both arthritis and osteoporosis can severely impact mobility and quality of life, making everyday tasks difficult and increasing the risk of falls and injury. Early diagnosis and a combination of medication, physical therapy, and lifestyle changes are crucial for managing these musculoskeletal conditions. The integumentary system, which includes the skin, is vital for protecting our bodies and maintaining overall health. Today, we'll be discussing two common disorders that can affect the skin cancer and eczema. Skin cancer is an abnormal growth of skin cells, often caused by excessive exposure to UV radiation. Early detection is crucial for effective treatment. Eczema, on the other hand, is a chronic inflammatory skin condition characterized by red, itchy rashes. Proper skin care and management can help control the symptoms. To prevent these conditions, it's important to protect your skin from UV rays, maintain a healthy lifestyle, and regularly check for any changes or abnormalities. Treatment for integumentary system disorders often involves a combination of topical medications, phototherapy, and lifestyle modifications to effectively manage the symptoms. Anemia is a condition where there is a reduced red blood cell count or hemoglobin levels, leading to fatigue, weakness, and impaired oxygen delivery to tissues. Leukemia is a type of cancer where there is abnormal production and growth of white blood cells, disrupting normal blood cell function and potentially spreading to other organs. The causes of anemia can include iron deficiency, chronic diseases, or blood loss. Leukemia often stems from genetic mutations or environmental factors. Treatments for anemia may include supplements, dietary changes, or blood transfusions. Leukemia often requires more intensive treatments like chemotherapy, radiation, or stem cell transplants. These hematological diseases can have a significant impact on a person's health and quality of life, so early detection and appropriate treatment are crucial. Viral infections can spread rapidly and cause a wide range of symptoms, from mild colds to severe respiratory illnesses like COVID-19. Viral diseases pose a significant public health challenge due to their ability to spread quickly and cause severe illness. It's important to understand the mechanisms of viral infections in order to develop effective prevention and treatment strategies. Bacterial pneumonia is a serious lung infection that can be life-threatening if not treated promptly. It often follows a viral infection, as the body's defenses are weakened, allowing bacteria to take hold in the lungs. Prompt diagnosis and treatment of bacterial pneumonia is crucial to prevent complications and save lives. The body's immune system plays a crucial role in fighting off infectious diseases, but it can sometimes overreact and cause further complications. Understanding the immune response is key to developing targeted therapies that can harness the body's defenses without causing excessive inflammation. Modulating the immune system may be an important strategy for managing severe viral and bacterial infections. Vaccination, good hygiene, and avoiding close contact with sick individuals can help prevent the spread of many infectious diseases. Preventive measures are essential to reducing the burden of infectious diseases and protecting public health. Promoting awareness. Cystic fibrosis is a serious genetic condition that affects the lungs and digestive system, causing thick, sticky mucus buildup and recurring respiratory infections. Sickle cell anemia is an inherited blood disorder where red blood cells become crescent-shaped, leading to blocked blood flow and episodes of severe pain. Both conditions are caused by genetic mutations that disrupt the normal function of important proteins in the body. Genetic testing and newborn screening are important for early diagnosis, allowing for prompt medical treatment and management of these disorders. The image on the slide provides a detailed illustration of the DNA double helix, with highlighted genetic mutations that cause these two conditions. Depression is a persistent mood disorder characterized by feelings of sadness, hopelessness, and loss of interest, as well as physical symptoms like fatigue and changes in appetite. Schizophrenia is a chronic and severe mental illness that affects how a person thinks, feels, and behaves, often involving hallucinations, delusions, and disorganized speech and behavior. Both depression and schizophrenia have complex causes involving genetic, neurochemical, and environmental factors. The symptoms of these disorders can significantly impair daily functioning and quality of life. Effective treatment often requires a combination of medications, psychotherapy, and supportive interventions to help manage the conditions and improve patient outcomes. It's important to emphasize the need for a comprehensive, multifaceted approach to addressing these psychiatric illnesses and supporting those affected. Lung cancer is one of the most prevalent and deadly forms of cancer, often caused by long-term exposure to carcinogens like tobacco smoke. Early detection is crucial for improving treatment outcomes. Breast cancer is the most commonly diagnosed cancer in women. Regular self-examinations and mammograms are essential for early detection, which significantly improves the chances of successful treatment and recovery. Researchers are continuously exploring new methods for earlier diagnosis, more targeted therapies, and improved patient outcomes for both lung and breast cancer. Advancements in precision medicine offer hope for the future. Polycystic ovarian syndrome, or POS, is a hormonal disorder that affects women. It can cause irregular menstrual cycles, excess production of male hormones, and the development of small cysts on the ovaries. POS is a leading cause of infertility in women. Prostate cancer is the most common cancer in men. It often develops slowly over time, so early detection through screening is crucial. Many cases of prostate cancer can be effectively treated, especially when caught early. Early screening and detection is key for managing both POS and prostate cancer. Congenital heart defects are structural abnormalities in the heart and blood vessels that are present at birth, ranging from simple holes in the heart to complex malformations. Early diagnosis and intervention are crucial for managing these conditions effectively. Autism spectrum disorder is a lifelong neurological condition characterized by differences in social communication, sensory processing, and behavioral patterns. Early identification and tailored support can help individuals with ASD reach their full potential. Children with these conditions often require a multidisciplinary team of pediatric specialists, including cardiologists, neurologists, therapists, and family support services, to address their unique needs. This comprehensive, collaborative approach is essential for providing the best possible care and outcomes for these patients. Parkinson's disease is a progressive neurological disorder that affects movement, leading to tremors, stiffness, and balance issues. Early diagnosis and treatment can help manage these symptoms. Macular degeneration is the leading cause of vision loss in older adults, caused by damage to the macula. Regular eye exams and early intervention are crucial to slowing the progression of this condition. Older adults with these geriatric conditions may also experience cognitive decline, depression, and an increased risk of falls. Comprehensive care and support are needed to address these additional challenges. Maintaining a healthy lifestyle through a balanced diet, regular exercise, and engaging in cognitive activities can help mitigate the impact of Parkinson's disease and macular degeneration. Diagnostic techniques are crucial for uncovering the root causes of different health issues. Laboratory tests analyze blood, urine, and tissue samples to detect biomarkers. These can provide important clues about what's going on inside the body. Medical imaging techniques like X-rays, CT scans, MRIs, and ultrasounds allow us to visualize the body's internal structures. Genetic testing has become a powerful tool for identifying inherited diseases and enabling personalized medicine. These diagnostic approaches work together to help us understand a patient's condition and determine the best course of treatment. Pharmacological interventions are a critical aspect of healthcare, as they involve the use of drugs to treat and manage various medical conditions. Understanding the mechanisms of how drugs interact with the body is crucial for optimizing their effectiveness and minimizing potential side effects. Pharmacokinetics focuses on the absorption, distribution, metabolism, and elimination of drugs, which determines how the body responds to the medication. Pharmacodynamics examines the relationship between the drug concentration and the body's response, allowing healthcare providers to tailor the dosage and administration for optimal outcomes. Identifying and managing the potential side effects of drugs is essential to ensure patient safety and well-being during pharmacological interventions. By studying these principles, healthcare providers can make informed decisions and provide the best possible care for their patients. A balanced, nutritious diet is crucial for maintaining overall health and preventing chronic diseases. Focus on eating plenty of fruits, vegetables, whole grains, and lean proteins. Regular physical activity like aerobic exercise, strength training, and flexibility routines can improve cardiovascular health and maintain a healthy weight. Incorporate stress-reducing techniques like meditation, yoga, or mindfulness to mitigate the negative impacts of chronic stress on physical and mental well-being. These lifestyle factors, diet, exercise, and stress management, work together to support overall health and wellness. Palliative care teams take a comprehensive approach to managing pain, using medications, interventional techniques, and complementary therapies like physical therapy and mindfulness. Advanced care planning involves thoughtful discussions about end-of-life wishes, such as preferred care settings and use of life-sustaining interventions, to ensure a patient's values guide their care. Palliative care providers offer emotional support and counseling services to patients and families, addressing the psychological, social, and spiritual aspects of serious illness and end of life. The goal of palliative care is to maintain the patient's comfort, autonomy, and quality of life, even as their condition progresses, honoring their humanity and personal preferences. Healthcare delivery requires close collaboration between diverse professionals like physicians, nurses, pharmacists, therapists, and social workers. By pooling their expertise and communicating openly, the care team can provide comprehensive, patient-centered treatment. Interprofessional collaboration fosters a shared understanding of each patient's unique needs, leading to more informed decision-making and improved outcomes. Regular team meetings, shared documentation, and mutual respect are crucial to maintaining this synergistic approach to patient care. The image on this slide depicts a diverse healthcare team collaborating in a positive, teamwork-oriented atmosphere. Informed consent is a critical ethical principle in healthcare. Patients must be fully informed about their treatments, the risks involved, and available alternatives so they can make autonomous decisions about their care. Protecting patient privacy and the confidentiality of sensitive health information is crucial for maintaining trust and respecting patient rights. Healthcare providers must carefully balance important ethical principles like beneficence, doing good, non-maleficence, avoiding harm, respect for patient autonomy, and justice when making difficult ethical decisions. These ethical challenges around informed consent and patient privacy are central considerations for healthcare professionals. Global health disparities in access to healthcare are a significant issue, with underserved communities and developing nations facing major challenges. The COVID-19 pandemic has further exacerbated these disparities, underscoring the urgent need for improved pandemic preparedness and more equitable distribution of resources worldwide. The data presented in the chart shows stark differences in healthcare access across regions, with North America and Western Europe enjoying much higher levels compared to Latin America, East Asia, and Sub-Saharan Africa. These disparities highlight the critical importance of global collaboration and investment to address the root causes and ensure all populations have access to quality healthcare. As we discuss solutions, we must keep these regional differences in mind and tailor approaches to the unique needs and contexts of each area. Telemedicine is enabling healthcare access for underserved communities and reducing in-person visits through video consultations and remote patient monitoring. Personalized medicine is using genetic data and AI analytics to tailor treatments, medications, and preventive strategies to individual patient needs. Digital therapeutics like mobile apps, wearables, and virtual reality are complementing or replacing traditional medications for specific conditions. AI-driven diagnostics are using machine learning to analyze medical images and lab results with high accuracy, detecting diseases and predicting outcomes. These emerging trends are transforming healthcare delivery and improving patient outcomes. Stem cells hold immense potential for regenerative therapies, as they can differentiate into any cell type in the body. Induced pluripotent stem cells are reprogrammed adult cells that regain the ability to become any cell type, enabling personalized treatments without ethical concerns. Ongoing stem cell research is driving breakthroughs in regenerative medicine, from tissue engineering to disease modeling and drug discovery. Stem cell-based treatments aim to repair, replace, or regenerate damaged tissues and organs, offering hope for conditions with limited treatment options. Preventive strategies are crucial for maintaining public health and reducing the burden of disease. Vaccination programs stimulate the body's immune response, preventing the spread of infectious diseases. Regular screening tests can identify health issues early, before symptoms appear, allowing for timely intervention and improved outcomes. Promoting healthy behaviors like proper nutrition, exercise, and stress management can help maintain overall well-being and prevent chronic conditions. Addressing environmental risks, such as air quality and water purity, can mitigate the development of certain health problems. These 4 key preventive strategies — vaccination, early detection, healthy behaviors, and environmental factors — work together to support the overall health and wellness of the population. Precision medicine and technological innovations are shaping the future of healthcare. Advances in genomics and molecular profiling will enable personalized treatments tailored to an individual's unique genetic and biological makeup. Digital health technologies like wearables, telemedicine, and AI-powered analytics will revolutionize disease monitoring, early intervention, and remote patient management. Regenerative medicine approaches, including stem cell therapies, tissue engineering, and gene editing, hold promise for repairing and regenerating damaged tissues and organs. Predictive analytics powered by machine learning will enable earlier disease detection and risk prediction, allowing for more proactive and preventive healthcare. The human body is a complex and interconnected system, with various organs and systems working together in a delicate balance. Studying human pathophysiology, or the abnormal functioning of the body, requires a comprehensive understanding of these intricate relationships. Adopting a holistic approach, rather than focusing on individual components in isolation, can provide valuable insights into the underlying mechanisms driving disease progression. This holistic perspective can help us develop more effective strategies for disease prevention and treatment by addressing the root causes rather than just the symptoms. Understanding the interconnectedness of the body's systems is crucial for gaining a deeper understanding of human health and disease.